Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. Hi, everyone. I'm so excited to have Dr. Wada here to talk about becoming immune competent with Sjogren's, MCAS, and more. Welcome. Thanks for being here.
Thank you so much. I have been looking forward to this afternoon on my calendar for like weeks.
Hey, me too. Well, and what's really interesting is I was taking a look back and realizing the first time I had you on the podcast was 2 full years ago. But that one episode is my most watched and frequently commented on YouTube video on my entire channel. So we really struck a chord. That one was called It's Not Just Dry Eyes, Delving into Sjogren's. So you've been doing really wonderful work. I've just noticed in the 5 years since I started Arthritis Life, I honestly, if you'd asked me in 2020 what Sjogren's is, I wouldn't know what to tell you. I knew something about dry eyes.
Yeah.
But now there's a lot more general awareness, and I think you're doing amazing work in this area.
Thank you. I mean, I think what was so humbling, to share a little bit of backstory for those who maybe are newer to the podcast and haven't gone to the deep cuts. But I think what was so humbling with my diagnosis was realizing how much of what I've learned has come from my fellow patients and did not come from my medical education. And an education that even had a focus on the immune system and many of the symptoms that are affected by Sjogren's. And even in spite of all of that, I learned so much more from the community. And it's kind of been with that I'm driven to make as many people aware, whether it's been residents or medical students that have rotated with me, colleagues at our green rounds, and also just anyone and everyone who will listen.
Yeah. I love that. And well, yeah, you anticipated my first question, which is what is your relationship to Sjogren's and rheumatic disease? Can you also let the audience know where do you live and what is your medical specialty?
Yeah. So I am based out of Columbus, Ohio area. I'm a lifelong Midwesterner, originally from the not Chicago part of Northern Illinois, where it's like cornfield and all that sort of thing.
Yeah.
I am board certified in allergy, immunology, lifestyle medicine, and I am over 3/4 way done through functional medicine training too. I see both kids and adults. I did both pediatric and adult training, like general training before my fellowship. And the really cool thing about allergy immunology as a field is no matter if you're a pediatrician or an internist or both, you get to learn how to take care of immune system problems in people across the age spectrum. So I didn't know that. Yeah,
I
it's
did
one of
not
the
know that.
few specialties that allows for that. And I think as someone who has a background of what's called med peds, so both pediatrics and internal medicine, it was a really
Mhm.
great fit because I love seeing people across the lifespan. I also knew though that I didn't have what it took to be a really great primary care doc, which is a lot and they don't get enough credit for it,
No.
that I wanted to focus in on the immune system. I've always nerded out in like immunology class and those sorts of and biology, how cells talk to one another. Like that stuff excites me. And that is the nitty gritty of the science that I am trying to think about as I am talking with a patient and really trying to get an understanding of their lived experiences. So I was diagnosed with Sjogren's disease coming up on was in 2019. So coming up on my 6 year
Wow.
anniversary soon. And it was within about 2 weeks of my daughter, my second born, at the time having an anaphylactic reaction to egg. We don't have any family history of food allergy. We didn't have any real family history of connective tissue autoimmune conditions. I had a couple cousins with inflammatory bowel, but this was all pretty seemingly out of left field. What I know now, maybe it wasn't.
Yeah.
And that really has been a huge turning point in both my personal life at home, but also my professional life as things have evolved.
Yeah, I totally I can relate to being able to connect the dots in the past. Like mine also, when I was diagnosed with rheumatoid arthritis in 2003, it felt like I came out of nowhere. But then I realized my great aunt, her nickname was Flea, and she got that from the fact that she had such bad knee pain as a child. She had most likely juvenile idiopathic arthritis. Back then, they just called it juvenile arthritis, and she would jump around on the beach. Instead of being able to walk, she would kinda hop, and my grandpa said she was like a sand flea, so they called her Flea, that was her nickname, and but hers went completely away once she had her first pregnancy, so we know that the immune system can change things up.
Mhm.
But anyway, initially, it still felt out of nowhere, and then but you can kinda connect the family dots maybe. But
Yeah.
back to your story, you mentioned you were diagnosed with Sjogren's. Can you tell people who might not know what is Sjogren's? How is it diagnosed? And how does it, because this podcast is about, typically I talk about inflammatory rheumatic diseases that cause arthritis, which actually, little known fact, but Sjogren's can cause joint inflammation. But so we have mostly talked about rheumatoid arthritis, psoriatic.
Yeah.
So yeah, can you basically give us the what is Sjogren's? We'll get
Sjogren's, when you see it written out, it is going to look like it's the name of a chair at IKEA because it's named after a Scandinavian eye doctor who first described it. It is one of the most common autoimmune connective tissue diseases, but it's also one of the least likely to be diagnosed. So one of the ways that I say that a little more succinctly is it's not rare, it's rarely diagnosed. It actually is thought to affect about 1 out of every 100 people, which is the same rate as something like celiac. And 90% of people it affects are female. So it does have kind of that difference in more often affecting women, but not always. It also tends to occur in adulthood, but there absolutely are people who are diagnosed in childhood, and there's pediatric Sjogren's. Often what's taught and what is taught to physicians in training all the way up through rheumatology trainees is that it's a condition that always has dryness associated with it. Dry eye, dry mouth. We don't talk about it as much because it's hush hush, but vaginal dryness, dry skin, hair stuff. The reality is, though, when you survey patients and you ask them what are the symptoms that are really most bothersome, fatigue and body pain are at the very top of the list. And, what I realized in my clinical work and as I thought about my own story as I peeled back the layers of the onion with symptoms. Most of the initial things I brought up to physicians over the years, they weren't related to dryness. Yeah, there was dryness. I couldn't wear mascara anymore. I wasn't able to wear contacts. The dental hygienist said something that's actually what pushed me to ask for an evaluation. But those were small potatoes compared to the like overwhelming fatigue. And for me, the body pain has shown up as stiffness in my low back. And it always got better when I was pregnant, which was weird.
Well, and that's
Uh-huh.
puts the ding, ding, ding for
Ding, ding, ding. Yeah.
autoimmune.
And
And
that's
then
where I had that like little kind of whisper in my ear of or this underlying gut feeling that I just wasn't ready to face for a long time. I will joke, I was like an ostrich with my head in the stand.
not the only one though.
Yeah.
And the fact that it was after the birth of your second child, right?
Yeah. Yep.
That
Everything kind of hit the fan.
yeah, but if you're
Yeah.
fatigued and you've just had your second child,
Yeah.
this
And
is-
you're a relatively new attending physician and your spouse is also in medicine and you don't have any family around. And it's really easy just to try to blame it on life.
life.
Stress.
It's I mean, when I
Depression.
little quick side note back to your story, but when
Yeah.
I had postpartum anxiety and postpartum, I guess I would call it postpartum depression, falls under the umbrella, but I didn't feel sad at all. I felt just
Yeah.
very not myself and constantly irritated and agitated, but also tired. And I remember one of the questions is, are you not finding pleasure in formerly pleasurable things? I'm like, I don't know, dude. I didn't have a baby a year ago. I don't know I've never had this before. I don't like that question is irritating me, which again, it was a symptom. My therapist eventually told me irritability is a symptom of anxiety potentially, which I didn't know. But that's so not me. Like I'm such like a happy go lucky person that even the fact that I was getting so irritated, this whole thing was like, this was bad. But anyway, you don't know. You've never had two kids before. You don't know what's the normal amount of tired.
Yeah. And that's when I chalked up like the brain fog and stuff. You always hear about, oh, I have mommy brain, that sort
Yeah.
of stuff. I also had some pretty long-standing digestive shenanigans, for lack of a better term, things in the IBS spectrum, but also certain foods that really would set off some pretty terrible symptoms. And those actually, I had some flare ups of those postpartum after my first pregnancy, too. So, again, kind of this fluctuation with those hormonal changes. And then the one other, so GI issues, typically with motility, IBS, but it can be kind of across the board. And one of the other big symptom, kind of broad brushstrokes that you'll hear, and there's thankfully been a really big increase in awareness and educational efforts around this, but its impact on the nervous system. So Sjogren's is the number one autoimmune cause of things like POTS, or the over umbrella term of dysautonomia. And increasingly, we're realizing that some of those dryness symptoms, like the dry eye associated with POTS, may not be inflammatory. For some people, it is, and things like restasis are helpful. But in a lot of cases, it's actually a nerve issue, and the nerve impulse that should be helping you secrete tears is not working correctly. And so that can result in symptoms of heat intolerance or not being able to sweat. The dryness symptoms that I mentioned, feeling like I don't have POTS, but if I change position really quickly, especially if I'm not well hydrated or it's hot out, I'll get kind of like, oh, I gotta like, so I have what's called orthostatic intolerance. My body doesn't like when I change positions too quickly.
Me too.
Yeah. And then often that's associated sometimes with gastric motility issues and can be associated with that body pain. So it's thought to be some of the driving factors in a fibromyalgia like process. So often what I'm listening for when I'm talking with patients is looking for or listening for signs and symptoms that maybe were attributed to fibromyalgia, IBS, those sorts of things. And like labs were normal. This is my one other little factoid I'll add in. Only 60 to 70% of people with Sjogren's have lab markers that are like the lab markers we're taught about. So about 30 to 40% of folks are considered seronegative or more normalish blood work. And that's where I think we have a huge gap in recognizing and doctors, frankly, for lack of a better term, kind of pussyfooting around with the diagnosis, not wanting to give that diagnosis or not wanting to treat. It's been taught that it's just a nuisance, and it's not. When you look at the data on how it affects quality of life, the symptom burden, it's the opposite. Anyways, that's my soapbox.
Yeah. No, and I think that's extremely important for patients to know about. That was my next question is, what advice do we have for people who think they might have Sjogren's? And similar to rheumatoid arthritis, it's very similar numbers. 60 to 70% of people with rheumatoid arthritis, especially at initial diagnosis, are seronegative. Some become seropositive over time, which means their blood work starts showing rheumatoid factor, and other anti-TCP and stuff like that. But point being, like, I think I'm such a rule follower that, like, initially, if someone had told me, like, so they did tell me because they didn't run every possible blood work. When I was first presenting with symptoms, they're like, your blood's normal, like your blood work's normal, you're fine. And then a month later, when I had more symptoms, they're like, they ran more blood work. They're like, oh, your blood work is now everything that we looked at is like off the charts. Like, you have rheumatoid arthritis. And I was like, wait, so that what you were calling my blood work, first of all, is not like one monolithic thing. But patients don't know. I'm like, oh, well, they did the blood work, like capital T, capital B, like, you just don't. So knowing that you can advocate for yourself to get, looked at. And I wouldn't know if I was presenting with vaginal dryness, dry eyes, dry mouth, maybe fatigue. I wouldn't know to also mention, oh, by the way, I have all these digestive issues and fatigue. Because if you don't know the symptoms.
Yeah. And you have 10 minutes, if that,
totally,
a FaceTime with your doc, and they're trying to get through that checklist as well. And so, like, you really have to be pretty strategic about what you're mentioning, right? And have kind of an agenda to, like, be heard within an insurance-based system.
Yeah. Yeah. And I think the only other thing I would add that's come up a lot in, like, my Room to Thrive support groups for the people that have Sjogren's is the swallowing.
Yes.
Swallowing issues. And that overlaps with rheumatoid arthritis because there's a joint in your throat, cricoarytenoid. Is that how you pronounce it? I just know how to read it. Yeah.
Yeah.
I could feel that sometimes. It sometimes actually clicks on my right side if I'm a little bit inflamed. That could also just be like postural. And if that's inflamed, it could be inflamed from rheumatoid arthritis, like that overall inflammatory type pain, or it could be you could have issues from swallowing due to Sjogren's because you don't have enough lubrication, right? Or neurologically, it's those impulses, like you mentioned, are not being sent accurately. So you have a sensation of food being stuck in the throat, which, how could you not be anxious, by the way, if that happened? I would freak out. Like,
absolutely.
Yeah. So know that if you're having a lot of swallowing issues and some of these other systemic issues, that it could be Sjogren's. Is there any other advice you have for somebody who is suspicious that they might have Sjogren's?
I think
if you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/Thrive Room with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
So a few things really critical to do a bit of homework before your appointment and kind of get your ducks in a row in regards to just sit down with a pen and paper or typing, whatever, however you get information out and organize it. And I think it's really helpful to let your doc know from the beginning of the visit, or even when you schedule the visit, these are my goals for this appointment. And are you able to partner with me on those or not? That's super helpful. And there also are some really great resources that our Sjogren's community has kind of come together and put together. So Dr. Sarah Schaefer, I can't say like enough wonderful things about her. She and Dr. Betsy Lobo run Sjogren's Advocate website. They have some incredible one-page resources that if you're getting pushback from your doc, Dr. Sarah is a physician herself. And so she wrote it kind of from that dual perspective as well. Of here's the evidence. It's all cited, but it's also very concise. It's one page, knowing that a doc doesn't have the time to do a big lit review. So I think having that's helpful, and kind of having your story and thing together. It's also helpful just to know, and to know that you can ask this when you call to schedule an appointment. You can ask, how long are these appointments scheduled for? Do you double book? Is there any way I could ask for a longer appointment? Become friendly with that receptionist or scheduling person as best you can. Knowing that, one, they're talking with a lot of humans all day who generally are not nice to them. So little honey goes a lot better than vinegar.
Yes.
And just kind of trying to tease that out. I think those are all helpful tips that I've passed along.
Those are so helpful. And I will definitely put a link in the show notes to the sjogrensadvocate.com resources. So well organized. There's even a page that just says self-advocacy for diagnosis. I'm like,
yeah, it's so great. And so I actually ended up putting together like what I call the Sjogren, I think I call it the Sjogren Superhero Starter Kit. It's like this free resource, right? And the first things I linked to were Dr. Sarah's things. So it has like a pre-appointment, like little workbook for people to think through, answer some of those questions on their own. And then links to all those resources, because it was pretty silly for me to like reinvent the wheel. I think there's so much work to be done, and we need to be like coming together, lifting each other up, and there's so much healing in that community. So if I could connect the people, it's great.
Yeah. No, that I just got back from an Arthritis Foundation like volunteer summit event that was so great, and it really reinforced to me as well the importance of community in the patient experience. We're all on the same team. We're all trying to get good care, and actually we are on the same team as our doctors. Now, insurance companies might be different. It was actually funny. There was one insurance representative though in the room. I realized, oh, okay, gotta be. But they're trying to work to make the system better, because sometimes you have to work within the system. Anyway, but yeah, I think these are extremely helpful pointers. And I think a lot of them apply for people seeking like a rheumatoid arthritis diagnosis as well. To really organize yourself as much as you can ahead of time, really pay attention to the pattern of your symptoms, what makes them better, what makes them worse. Is there any kind of rhyme or reason that can really, because you can kind of almost anticipate the questions the doctors might be asking you. So
It's we try to be detectives.
yes. Yeah. And it's like you mentioned partnering with your doctor. That is, you're not an adversary. Or if the doctor feels like an adversary, or they're kind of like, oh, you're just trying to like doctor shop to get a diagnosis, then might not be the right doctor for you. So
Yeah.
I was going to ask also just, I know the main focus that we're leading up to in this episode really is like, what does it mean to be immune confident? I really love that phrase that you have a whole program now about becoming immune confident. So we're going to get there. But I wanted to have one more minute one more little section on MCAS, mast
Yeah.
cell activation syndrome, because two of the past people who've shared their stories on this podcast have had that condition, but we haven't really delved into it from like, had a doctor explain. What is it? What causes it?
Yeah. So mast cells are white blood cells or infection fighting cells that are responsible for helping our body determine if we are safe or not safe in our environment. They do that along with our nervous system, like our sensory nerves. And they are found in the same locations. So they are working together, and there's a lot of crosstalk between these mast cells and our small fiber nerves. These cells are found in all the places in our body where our body is going to interface with the outside world. So our barriers, our skin, our respiratory tract, our gut, our genital urinary tract. They're also like those barrier tissues also are our connective tissues, right? Most of them. And they're also found near blood vessels. So they're kind of helping with this crosstalk between all these different systems in our body. And as allergists, we've been interested in mast cells for quite some time because we realize that they are responsible for essentially all the symptoms we attribute to allergy: itchy, sneezy, hives, wheezing, anaphylaxis, which are those whole body reactions. As allergists, though, we have been a little preoccupied with the fact that a specific protein or antibody that we can create called IgE functions as a receptor on the surface of these cells. So if you're someone who's allergic to your puppy dog or you're allergic to peanuts, you make a specific IgE protein that recognizes peanut or puppy dogs. And when you inhale puppy dog dander or eat peanut protein, that triggers those mast cells to release all these chemicals that are pre-made inside of them. And it also gets some machinery going for some later actions. But some of those preformed little packets of chemicals include histamine, tryptase, prostaglandins, leukotrienes, whole bunch of things that then tell our body, danger, danger, there's a problem. And it's in this, and triggers inflammation, but it's in this allergic flavor of inflammation. What we've neglected to put much emphasis on, like we've known that this happens, but it hasn't been a real emphasized aspect and hasn't been super well researched, is that these cells don't get triggered only by those allergy proteins. They have dozens, if not hundreds of other types of receptors on their surface that also can trigger them. So we've known for a long time that some people are more sensitive to opioid pain medicine. If they have a surgery and they get morphine, they get super duper itchy and hivey, maybe more than the average person. Though there's a specific receptor on those cells called the MERG receptor that medicine like works through. Or heaven forbid you have a bad infection and you need an IV antibiotic called vancomycin. We've known that if you infuse vancomycin too quickly, that a lot of people will get a histamine reaction. They'll turn red and get really itchy. Or with contrast, for a CAT scan with contrast, another irritant for those mast cells. Some people, if you Google, it's a long term, but dermatographism, it means writing on the skin. Some people, just that pressure or scratching on their skin, that physical
Yes.
disruption will cause hiving. So folks with mast cell activation have an abnormal increased response to stimuli that their body shouldn't be responding to. The big problem right now is that there are two main camps of healthcare professionals, doctors, that have differing views on what those diagnostic criteria should be and how we should be taking care of these patients, and they don't get along very well. And so as a result, the care for folks with these conditions, for a multitude of other reasons too, they can affect you from head to toe. And typically patients will play this game of hot potato, getting referred from doctor to doctor. They'll go see the allergist. The allergist will do their allergy testing, which won't be super helpful because usually it's not true allergy that's driving the process. And it's a mess, frankly. But patients are really suffering. And we've seen a pretty significant uptick in the number of patients we've seen with this constellation of symptoms in recent years. And we think COVID probably added lighter fluid to this whole situation, like it did with other autoimmune conditions too. So it's not specifically an autoimmune condition. I consider it in my mind an autoinflammatory process. So it's still inflammatory. There is often some sort of internal increase in the set point, but typically there aren't necessarily those antibody proteins that are triggering it, which is often the distinction between autoimmune and autoinflammatory.
That's really helpful. I actually think there's I was going to ask, would it be correct to say, because I often have to stop and remind myself what the difference is. The autoimmune is like you're making antibodies to your own tissue versus
Typically.
autoinflammatory is there's inflammation happening, but it's not towards your own tissue. Okay.
Yeah. And well, often it's driven by more of the innate immune system, which is kind of we all like almost all beings have some your innate immune system doesn't necessarily learn in the same way over time as your adaptive immune system.
Okay.
But again, this gets really muddy really fast, but those are the broad brush strokes.
And then, no, that's very helpful because I've been hearing more about it. And again, another condition that even though I really had started specializing in rheumatoid arthritis, I hadn't heard of it, even though it's one of those ones that if you have one autoimmune or autoinflammatory condition, you're more likely to have another. So it's good to know about.
Absolutely. And so it's interesting. There is absolutely zero research to back up what I'm going to say. So that is my disclaimer. I strongly suspect, based on what I'm seeing and hearing clinically, that there is a relationship between Sjogren's disease and mast cell activation. Similar to how we will sometimes and suspect we're seeing the same overlap with hypermobility and autoimmune or mast cell issues and dysautonomia. Sjogren's is, I talked about, a lot of dryness at the barriers, right? So if you have a breakdown at the barrier where that interface of the body's insides and outside, and more permeable or leakier, there's more opportunity for those mast cells to be seeing more of the outside environment and, frankly, freaking more out.
Yeah. It's such a fascinating concept that what these systems are designed to protect you and keep you safe. What happens when they go haywire? And it's kind of an interesting parallel to even for me living with anxiety. It's a similar thing, right? You're like your anxiety is there to protect you, but when it gets too out of proportion to the actual threat, that's when it's not helpful or adaptive anymore.
Well, and here is kind of this I always tread very carefully with patients because so often our anxiety, especially as women, is weaponized against us.
Yes. Yeah.
But our brains and our bodies are not separate. Yeah. And so there is some data to suggest that there can become an abnormal feedback loop where if your brain is sensing that you are not safe, like that lizard part of your brain is like not safe, that is priming your immune system to be more hypervigilant. And so often when I'm talking with patients about kind of taking a holistic approach, we're talking about some of this mind-body medicine and getting a sense, like, how comfortable do you feel with this? Does that sit well? I've had a few patients say, hey, no, this just feels like gaslighting. And I'm like, cool, we're going to stay away from that. That's fine. But it can be helpful.
Yeah, and I think it's all I've thought a lot about this too because I would say, been medically gaslit when it came to my initial diagnosis where they said you're just anxious, you're not sick, as if it's impossible to be both anxious and sick. And also as if it's not rational to be anxious if your body's like breaking down and you have no reason why. But anyway, um, but it is because of that, I was so resistant to therapy or addressing my mental health because I had felt so the example I use is I felt like my body was on fire and I went to the firemen and they were like, or fire people, and they were like, you have a disorder called like person who thinks their body's on fire, but it's not. And then 2 days later, it's, oh, actually your body's on fire. We believe you now. I didn't change. You changed. But anyway, it's hard not to feel defended.
So I have a little bit of kind of maybe explanation, I think, why that happened so much, like why we put so much stock in labs. When we're in a system that expects us to see a new patient every 10-ish, 15-ish minutes, depending on 8 minutes, depending on what field you're in, you have to start defaulting and kind of making some of these cognitive like shortcuts, right?
Yes. Yeah.
In order to get through your day and not just be like, "Ugh," and get bogged down. And so we have grown up and had our training in a time where we've had this incredible increase in our availability of blood work, lab tests that give us black and white answers. And I think we've become very over reliant on that and don't allow ourselves to give as much stock to the patient's lived experience.
Yeah.
And take the time to actually let that sink in and use our history taking and physical exam skills like we initially were taught. That's still what's emphasized in your first few courses, right, in med school. But when push comes to shove and you turn up the speed of that conveyor belt, all that goes out the window and you focus on that black and white because that's what's in front of you and that's what can get you to the next room faster.
Yeah.
And survive your day as a human being too.
Yes. Yeah. I think, it's just like with like medical errors with gaslighting, it's really critical not to see it as like an individual bad actor situation. There's systemic factors. There's huge systemic pressures.
And of course, there are some bad apples in every group.
Yeah. Yeah.
But I think what drives it more than anything is whatever we want to call it, burnout or moral injury, what have you. We kind of talked about, or I was talking with a patient this morning about the medicine I'm practicing now and then I'm aiming to continue to practice is the type of medicine I signed up for when I went through all that I did to get into medical school and to graduate. That is not where I was 4 months ago.
Yeah. Well, okay, so this is perfect segue. I want to give you a chance to explain kind of the origin story of your work now. And you said, I know you and I are both, I don't want to be projecting, but similar, like a little bit of like used to be perfectionistic or wanting to be the good girl in class, wanting to get a gold star. It's kind of from past conversations we've had.
Treadmill and success.
And you've spoken about it on trying to be just not goody two-shoes, but like a rule follower.
No, that would be very accurate.
Okay. Yeah, I'm like, I am so good at following the rules.
Time.
I'm going to follow the rules harder than everyone else in the class.
Yeah.
And now you have said recently you want a doctor who is a bit of a rebel. What does that mean for you? Why is that?
And I think a bit is that you don't want someone who is like so out on left field that you're like, oh gosh, do they like know the science? Or are they like making some real crazy recommendations? But I think when we are trying to function within a system that is frankly a dumpster fire, it is
the healthcare system. The health is
yes, for both patients, and I would say, and also very much for healthcare professionals as well, not just physicians, but for nurses and medical assistants, like across the board. It can really, I think, help to find someone who is pushing back against the overwhelming pressures to see more people in less time. And that's kind of where I'm coming from that rebel. Someone who is willing to and able to take that time to, one, and I say this for any healthcare professionals listening, realize the importance of their own health and how that influences the health of their patients or clients. Because I can say when I was not taking care of myself, I was not able to take care of my patients to the best that I would want and they deserve in regards to my own ability to listen, to take on their lived experience, to think with curiosity and creativity and how we're going to make a personalized plan for them, to meet their experiences with compassion and empathy. Like, you can't do that if your own cup isn't at least halfway full. And the current system requires a rebel in order to do that almost across the board. So essentially things kind of came to a tipping point last fall when I got word that my salary was going to be cut again. And I went to leadership and just said, hey, second most senior in the department, I really love caring for patients with complex immune system problems. These patients take longer to see in the office. Kind of made my case. And unfortunately, with how medicine is reimbursed and reimbursements from insurance have not kept up with inflation and other things.
And that's across the whole board, I can
That's
say, as
across
occupational therapist. It's for
all
all
healthcare.
therapies, all
Yeah.
specialties. Yeah.
And when you look at the increase in healthcare costs, there's a really nice chart that's kind of gone viral. It's not cost driven by physicians or other healthcare professionals. It's the cost of doing business. It's cost of administration that's really
Middleman.
those
Yeah.
up.
Yeah.
And that's a lot of the issues when I was in a larger organization, I had no control over my overhead, the cost of rent or how much staff I had or supplies and all those things. And so I made kind of the really tough decision to leave a job that I genuinely loved. I loved the people I work with. I love my patients. I loved having the ability to help teach future physicians, both kind of across the spectrum of their training, and to embark on doing things a bit differently. And so I opened what's considered a direct specialty care practice. So what does that mean? It means I am out of network with insurance. I contract directly with my patients. Patients are able to, if they have out of network benefits, they are able to submit some documentation with the hope that they might get some reimbursement. That was a tough decision for me to make because I realize how expensive it is to be sick and to have a chronic illness. I also realized that the extra cost it was going to entail for me to have more staff to make sure I was getting paid for the work I was doing within an insurance-based system was going to put me back on this treadmill of having to see more people in less time. And I could not do that any longer. So today I saw 3 patients. Yesterday was a busy day. I saw 5 patients. In my prior life, I would have seen 12 to 14, which even like within my field is actually like on the low side. More often in a private practice allergy office, they're going to see somewhere 20 plus patients a day. So I've had an hour, sometimes 2 hours with those new patients because that's what you need when you're talking about multi-system issues that affect people from head to toe. When you're talking with people who they've seen how the sausage is made in a healthcare and they just need to get that off their chest. Like that in itself is really therapeutic, just having that witnessed. And to be able to set up a practice that I preface every initial visit with, I want you to feel safe and respected in this space. And whatever I can do to help support that to my abilities, let's do it. Because the system is supposed to be healing, it's not supposed to be harmful. And when I finished schooling, you take that oath to essentially do no harm, right? And it came to a point where I needed to rethink the system that was not only doing it was doing harm to me and it was doing harm to my patients. And so this is the best I've come up with so far.
No, and I think it's very commendable. And I think I've tried to highlight the work of people like you on who are really trying to figure out creative ways to better serve patients. I mean, it is just beyond tragic that you were basically told in the conventional healthcare system that because you wanted to see is let me know if this is right to say, because you were specializing in seeing patients with more complex issues, you were each year being told, okay, because you're choosing to see these difficult to treat quote unquote patients, we're going to give you less and less money. That is so opposite. It feels like the people who are
Because from a system standpoint, they make the system less money.
why?
I'm not putting them on allergy shots. I'm not doing skin testing. Like those are things that are the bread and butter of an allergy practice and essentially keep the lights on. So
In every new patient, and actually this happens with occupational therapy too, where the new patient evaluations, an hour and a half, I would spend an hour and a half in pediatrics doing a new patient evaluation. That was charged at a much higher rate because I did have to do a bunch of paperwork afterwards and think through their treatment plan. But then the hour-long appointments were at a lower rate. Okay, so it's like these evaluations, and then you're submitting for, but that's just so, it's just like logically and in my heart, it's just what a horrible message to send to these patients that
it's how in general, though, one of the big issues, global issues with how healthcare in the US is reimbursed, specialties that are more quote unquote cognitive, that are evaluation and management or E&M type visits that are non-procedural visits, are billed at a much lower rate than generally procedural based things. And that's no greater reflected than in this huge pay disparity for our general pediatricians, our family practice docs, our general internal medicine, primary care docs. They are, I give so much credit to those who have stuck it out and have the passion to serve their patients because the system is just really left them up a creek without a paddle.
it's so, yeah. And I think that there's no other choice than to say, okay, we have to subvert the system. I mean, my own therapist, he's a psychiatrist. He does the same thing you do, and it's becoming super popular in occupational therapy, physical therapy too. It's direct care, like you said. I pay my doctor out of my credit card, so I get the miles, I get the credit card points, and then I submit to my insurance, and they cover his services, so psychotherapy, at the out-of-network rate. So he charges X amount of money, and I get that reimbursed into my bank account from and it only takes a few minutes for me to upload a super bill. I always thought a super bill was like this big thing. It's like 2 pages from my doctor, my receipt and my super bill. At least this is for psychiatrists. It may be more straightforward because it's just like I saw her and helped her. But it's becoming more common because of how draining and inhumane the a lot of the traditional systems are.
Yeah.
And you can get you can get stuff covered. So
Yeah.
I don't know in your case how often it is, but that's just for people to know when you're paying your monthly premium on your insurance in the United States, if you look into the details, you can find out that out-of-network rate means that you're still paying for that option for them to pay to reimburse you for these out-of-network providers.
Always helpful to check ahead of time.
Yes. Yeah. Yeah. And so I mentioned earlier, tying back to something I said 30 minutes ago about becoming immune confident. Yeah. You're calling it the immune confident approach, right?
Yes, and the practice is the Immune Confident Institute.
I love
The
that.
theme here. One of the things that I realized upon reflecting in my own illness journey
Mhm.
was how defeated I felt, like just that overall change in, for lack of a better term, my energy. It's like I went from feeling confident, doing my thing, to doubting myself, not listening to my body, kind of this erosion over the years of that illness manifesting itself. And I kept hearing echoes of that same process, patient after patient after patient, like indecision, not knowing what the next best step is, not trusting in their sensations and the things they feel in their own body, not trusting the medical system, right? Understandably. And so I came back to this idea of, gosh, as I started feeling better and as I started keeping promises to myself and like kind of went through this evolution, one of the things that came back has been my confidence. And with that, now my ability to be a rebel or be a little more rebellious. And in immunology, there's this term called immune competent, which means your immune system is working well. You're able to make responses to your vaccines and your infections and fight them off. And so there was this little play on words that was an inside joke to me, but also this idea of something greater than just the physical immune system health, but also our own psychological, social well being. And it probably comes a little bit along this path. I got my life coach certification. So there's probably a little bit of that kind of thrown in there too.
You have been busy. She also had another baby, by the way.
Yeah.
3 kids.
Maniac. So
Gone. Do you
he's
sleep?
3,
By the way,
and he's just, oh my gosh, he's so full of energy.
yeah,
I'm
yeah.
meeting with the daycare this week because he's
Expressing
not using his
himself.
family for hugs. So
Yeah, yeah. Oh, I'm sorry. Ooh, that's hard.
yeah.
But I love that. I actually didn't know that immune confident was a play on words for immune competence, but I think
Yeah.
that's beautiful. I think I've had a similar experience with my own journey. It's like what I want to feel at the end of the day, or what's required for me to feel like I can quote unquote thrive or make room to thrive with
Yes.
my multiple chronic conditions, which does include dysautonomia and gastroparesis and stuff like that, is like feeling that I have these tools to cope with what is happening to me. And one set of those tools is the fixing tools, or making the pain get better, or controlling my disease. And then the second set of tools is the coping and accepting what are the things that I don't have control over. I think that therein, the delta between those and figuring out which bucket which one goes into feels to me like the source of stress for a lot of people. If you assume that every single part of your health is going to be fixable and under your control, you are going to be chronically extremely disappointed. But without a guide person, without if you all you have is a doctor every 3 months for 10 minutes to ask your questions to, how are you supposed to feel confident in differentiating between what you can and can't control?
Yeah. Other piece is kind of how we have things set up on in this clinical practice is certainly had the ability to see people once and do that consultation and get them some recommendations to follow up with their care team. But I also felt really strongly about leaning into a membership model and having some flexibility there where one, all of our members have the ability to contact me between visits, kind of using essentially a text app called Spruce. It's super user friendly.
Is this like concierge type
Yeah, it's
approach?
kind
Yeah.
of setting it up with that, but also trying to keep our price. Like I'm trying to do that in a way that keeps the lights on and
Yeah.
allows us to grow and serve people, but also allow them to feel safe. And especially with our folks with mast cell issues, and you have certain things in your environment that will trigger symptoms, having that safety net makes a huge difference. And
Yeah.
so having that ability for folks to reach out to us, to know that They're going to see me at least quarterly. And depending on the plan, some folks want to see me twice a month so that we have that flexibility and just trying to be ultra transparent with pricing, because I think that is what has driven me up a wall as a patient and as a physician, is not knowing what things are going to cost me or my patients. And don't
You're clapping for those
do
listening.
not nickel and dime me. Like, it just drives me bonkers. If I set it up where people were like, oh, every 15 minutes of my time is X amount of money, it's harder to budget. Like, 'cause you don't know how much you're going to have to reach out to me. And I don't want you holding off on reaching out to me because you're worried about how much it's going to cost. That just adds another stressor to the system.
Yeah.
Anyway,
Yeah.
I tried to be thoughtful about all this.
No, me too. When I first started, my very, very first, actually was exactly 5 years ago, because I knew it was April, but I just saw one of my like Facebook's memories, but come up, and I had really dug in and figure out like how to start a business, and how even do I make it a nonprofit or for profit, all this stuff. So I structured it as a business LLC, and I did all these trainings, and one of them was so scammy that I obviously did not follow it. But it was like, don't tell them what it costs until you get them on the phone. I was like,
How much of that? That just makes me feel icky.
that does not align with my values whatsoever. And it made me, I got on the phone with somebody where that was required for me to talk to them. And I really felt like it was disrespectful of my time. Because when she told me what her service cost, I said, honestly, if I had just known that, I wouldn't have wasted your time or my time, because it doesn't matter how great you are. I literally cannot afford this. And I don't want to basically be subject to you explaining to me that I actually can, when I don't want to afford this. This is not where my money needs to go right now. Anyway, so I appreciate that about your model, and I'm very transparent about pricing for my programs too. I think it's
I think this is why we get along so well.
we were saying before we started recording that we were both
Even with
speakers.
for sisters.
Yeah, but we were speaking at a conference, and I was like, "Are you sisters?" It was so cute. I was like, "Thank you." I mean, there's so much more to talk about. I am putting a link to the Becoming Immune Confident website, and where you can learn more.
drcarolwada.com. We kind of simplified it all.
That's good. Yeah, and you're you've iterated over the last, trying to be creative. And that's good, right? You just don't want things to be stale or whatnot. You want to you want to change things according to the needs of the people that you're meeting. The last thing, if you have time, I know you've been talking about your clinical trial you're participating in for Sjogren's. What is kind of the latest in Sjogren's treatment?
Yeah. So Sjogren's currently, as of April 2nd, 2025, there are no FDA approved treatments for Sjogren's disease. That being said, there are multiple medications that are in phase 3 clinical trials, which is like the last step before approval. One of them actually was just granted kind of fast track approval or status. So not approval, but fast track status. That's Johnson & Johnson's. And I honestly don't know how to pronounce the name of it. That particular med essentially helps the immune system cut down on how much it recycles those antibodies. And by cutting down on the recycling, it should drop, theoretically, the antibody levels and decrease probably then how many of those autoantibodies are floating around. So that's that one. I am in between month 8 and month 9 of the OASIS trial, which is dazodalibep. It is a 90-minute infusion that I get every 4 weeks. When you participate in a clinical trial, you have a chance of getting placebo versus the active medication. In this particular trial, there are actually 2 arms that have the active med and 1 placebo, because they were trying 2 different dosing, like ramp-up dosing. I'm pretty sure I'm getting active medication because I have seen more tears and saliva and other kind of symptom improvement. I've also had a little whiff of side effects, but nothing that would prevent me from being like, infuse me. I do have to drive an hour each way because the location is not in my city. It's out in Dayton, which I'm very thankful I have the ability to do that and the flexibility in my work to do that. One of the other benefits, so one of the questions that's asked about participating is, why would you want to participate if you could be driving out there for a year and be getting sugar water in your veins or salt water? How my thinking is, and this is just my thinking, there's something at the end of the trial called open label extension. And so as I was weighing those pros and cons, what I really thought about was, would I be okay, or it wouldn't be ideal, but if I got that placebo for a year, I still would have access to the actual drug, probably at least a year sooner than just a random Jane patient. And to me, that felt okay. But everyone has to make that decision on their own.
Yeah, I think that that's such a great thing that most people don't know about unless you've looked into clinical trials, that if you don't end up getting the active medicine and the medicine ends up being safe and effective, then ethically they do feel it's necessary and important, which I agree, to give, so that you're not giving preferential treatment to people just through random assignment. You're saying, okay, well, you got the salt water, but now we're going to give you the med. I think that
Yeah.
makes a lot of sense. And I think it's really exciting to hear that there are more treatments.
And there's more in the pipeline too. It's what you will see. So this is like the crystal ball, is you're going to see a big increase over the next probably year of disease awareness initiatives. So this is what pharma does.
Mm-hmm.
Pharma will start talking more about the condition, getting more the word out, usually about a year or so before the treatment is approved. Then they'll start advertising the treatment. Now, we'll see if this may change with some of the changes in all that's going on in the world, but that's typically how things have played out.
I mean, it makes sense. Especially, it's such a circular problem when you have a condition that people may not even know that they have, that you need to get the word out about it. I know that for those who also might have like lupus or rheumatoid arthritis, there's a lot of clinical trials going on right now in CAR T cell therapy. I know they are for Sjogren's as well.
Yeah.
They're mostly in
First patient, I think, was treated up at UW Wisconsin.
Oh, so that's so funny. We have a little rivalry because I live near UW.
Yeah.
So, no, but that's really exciting because that's leading to the possibility of a long-term drug-free remission, which of course would be ideal, would be effectively like a cure, people are saying. So I'm excited for that.
Oh,
Yeah. Well, I'll definitely be sure to come back and I can update the show notes when you find out whether you had the placebo or not. Maybe
it's about a year-long trial. So maybe midsummer, I think.
Okay. I'll try to remember those listening. Keep me accountable. If you're listening to this in summer 2025, remind me. Remind me. Yeah. And so I thank you so much. This has been so great. We always feel like we have so many more things we could talk about, but time-wise, I want to give you time to get to your kiddos and me.
They're going to come busting in and probably come join the show.
Oh, that's okay. Yeah. What is some of your best words of wisdom for somebody who might be listening who's newly diagnosed with maybe Sjogren's or MCAS or a similar condition?
As best as you can, try not to get stuck in the overwhelm. I think just take a deep breath and a pause, and then think about, what is that next best step I can take? Like, little baby step. Don't feel like you have to, I'm going to use all the cliches. Rome wasn't built in a day. Do not do what I did, which was, excuse the expression, balls to the walls, trying to make everything perfect, leaning into that perfectionism stuff. I ended up like frying my liver temporarily. That's, I think, in the first episode. Like, what is the next best step forward? Baby step. Treat yourself with some compassion, and it's okay. It'll be okay.
Yeah, I love that. And I really appreciate, I definitely encourage people to listen to the previous episode because not a lot of people talk about negative experience with supplements and stuff like that. And it's so common. It's so common, but there's just not talked about because people feel ashamed. So I think it's so important that you share that story. What does it mean to you? This is kind of the $10,000 question, to live a good life and thrive with Sjogren's.
So I think one of the things I keep coming back to, and I think has been some of the most powerful kind of quote unquote internal work I've done, is taking the time to figure out what my core values are and making decisions in alignment with those. And I think that has steered me towards better understanding what a good life is overall and a good life living with Sjogren's and dysautonomia. And for me, it's really been leaning into connection with other humans and those that I love, leaning into curiosity. Like I love learning, I being that detective and getting to know other people and transparency. I am who I am. You get what you get with me and trying to lean in, not to put on just to be authentic me, but also in what we were talking about with pricing stuff and all of that. And I think that has really just helped me better know who I am and what I stand for. And that's made the biggest difference in really perceiving this as being a good life and thriving.
That's so beautiful. And I love that it's, I think, well, I hope not to give away my own agenda, but one of the things I'm hoping that when people listen to many of these episodes and hear how different people think through this question is that I think when you first get diagnosed, the presumption people have is that what it means to thrive and live a good life with this is to conquer it and make it go away. And I cure it or make it I really listen to these messages that are given out by really well-meaning people and say, oh, how did you conquer your arthritis? How did you conquer your Sjogren's? And it's not, it's about living what you're saying, living according to your core values, and your conditions are coming along for the ride potentially versus, yeah.
It's putting yourself back in the driver's seat
Mhm.
and
Yeah.
also not holding on to the wheel.
Yes, I mean, I think this is like a perennial topic
Yourself
for me.
done.
Yeah, the acceptance piece has been, I was dragged kicking and screaming into acceptance, but once I got there, once I opened myself up to the possibility of accepting that not everything's under my control in particular, it was such a gift to be able to let go of control, but it felt impossible. I felt like there's no way I'm gonna be happy with that. There's no way I'm gonna be okay with not being in control. And then once I did, it was like, oh, like that what you hold holds you. I was being held back by the idea that I just need to control everything. And now the world is more open to me. Anyway, that's my story. But this is so great. And I love values work. It's funny, when I first made the Thrive acronym for the Room to Thrive program, the V, I struggled with what the V should be at first. Because I had the ideas of what I wanted to teach and what I knew was helpful. But I was like, I want this to fit into the Thrive. I wanted to spell out Thrive. And I was like, V is going to be, I know I want to talk about values, but I was like, is it going to be exciting enough to people? Like values, are they going to just be like, blah, what? Like, why does that have to do with arthritis? But it's everything to do with quality of life. And if you don't know what your core values are, then you're constantly going to be changing the goalposts and just going with the whims of what other people say is important. So anyway, I love that you have that in there. And then is there anything else that now that your kids are trickling in home and my dog?
I told them they can watch the TV, so they'll be excited for a little bit.
Yeah.
Because now that they've been a bit of a stay-at-home mom with them after school, I've tried to, anyways, find that balance. But I think the only other thing I wanted to make sure folks know is, although I'm located in Ohio, I am licensed in a whole bunch of states. So that list is being kept updated over on my website, drcarolwada.com. And even if I'm not licensed in your state, I still can meet with you for educational visits. So I can't meds or do labs or things, but can be there as kind of that advocate, that sounding board, if you would find that helpful. So
that's so helpful to know. And again, that's one other part of the healthcare system people might not know about this, that anyone who's licensed as a health provider is licensed in the number of states that they are licensed in, then that dictates where you people can.
And the only other thing that I kind of put you on the spot beforehand, but every summer, this will be the 4th year that we are hosting the virtual Sjogren Summit. And I can't remember the exact title of our theme, but in general, it's like building your network. And so we're hoping that Cheryl can join us this year.
Oh, yes.
Calendar allows, but it's
Yeah.
a really great, it's free to attend live. And then there are some paid options too, but a really great place to connect with others in the community, learn more about the condition, and hopefully make an impact.
That's huge. No, I would be honored to present at that. And it reminds me that I had never exactly announced that I was not doing the Arthritis Life Hack Extravaganza for 2025, and no one's asked. So I mean, people are maybe just kind of like, whatever she does stuff, I'll show up if I can. But yeah, and we did an Arthritis Life Hack Extravaganza event 2022, which you spoke at 2023 and 2024, and I really had a need. Yeah, I needed to really take a step into the 20,000 foot view and really assess like, where does my energy need to go? And I'm redoing some things or improving some things with the Room to Thrive program that I'll be announcing later in the spring. So anyway, again, it's funny because you think, oh my gosh, they're all going to be so disappointed. Literally no one has asked. So it is on a little hiatus, but that's my program. It just, made me think of that. But
Maybe you can scratch the itch over at the VSN then.
Yes.
And not have to deal with all the headaches with putting on an event.
Oh man. Yeah. No, I really appreciate that you're continually doing the virtual Sjogren's Summit, and just appreciate you taking the time today. Keep up the awesome work. I wish I was closer to Ohio, then I would give you a real hug.
Oh, well, we're going to meet up one of these years.
Yes. Well, I forget how far Columbus is from Chicago, but I will be in Chicago in October 2025 for the rheumatology conference, the 24th through 27th, I think it is. Yeah.
Okay. I'll see what I can do.
Yeah.
Maybe I'll plan a visit to Grandma.
Yeah. Oh, is grandma's still in
She's in the suburbs.
Okay.
Yeah. Her birthday's tomorrow. 94.
Oh my gosh. 3 of my 4 grandparents lived to 94. Fun fact. So I'm like, well, I hope that those dreams come down.
No.
Happy birthday to your grandma. So sweet. All right.
Thank
you so much.
Care.
See you later. Bye. Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.